everyone. My name is Alex Hughes. I am a lead nurse practitioner here at Austin Urology Institute under direct supervision of Dr. Kaushik Shah. I'm here to discuss to my female and male patients, but my female primary patients, and I'll talk to you why that is during the presentation, about modern solutions in women's urology regaining control of bladder and bowel health. The main products we're going to be speaking about today are Bulkamid, which is for stress urinary incontinence when you leak, when you cough, sneeze, or work out. Celesta, which is for fecal incontinence, which is an injection here done in the office, primarily if you smear or any unwanted stool in your underwear. Bladder Botox for urinary frequency and urgency, and sacral neuromodulation that covers kind of all of the territory, frequency, urgency, and fecal incontinence. So why do we speak about this? Millions of women live with bladder and bowel control issues that impact daily life, intimacy, and self-esteem. Common conditions that we're going to be covering today: overactive bladder, stress urinary incontinence, fecal incontinence, and chronic UTIs secondary to the things that are above, and poor bladder control, emptying, and leakage of urine and stool. So mainly what we're going to be talking about is effective low-risk in-office and outpatient solutions now exist. It's not just here are some pills and deal with it. So again, Bulkamid's going to be for the stress urinary incontinence, Celesta for fecal, Bladder Botox for OAB, and axonic sacral neuromodulations for OAB and fecal incontinence. So why does this matter? These are often underdiagnosed and undertreated problems. Patients often feel embarrassed and assume it's just part of aging. It's just kind of like, hey, I'm getting old. I'm going to, leak a little bit of urine. I'm going to leak a little bit of stool. They just deal with it, when in fact, you don't have to do those things. You don't have to just deal with it. As providers, we can offer life-changing treatment options that are fast, safe, and durable, and they're covered under most insurance. So what do we usually try first? So if you're coming to your doctor and you say, hey, I'm starting to leak a little bit of stool, or hey, I'm starting to go to the bathroom more often, most of the time they're going to start you with some medications first. The oldest medicines out there are antimuscarinics. This is oxybutynin, tolterodine, and sulfenicin. They block the muscarinic receptors to reduce bladder contractility. So basically, it makes the bladder stop from firing all the time. The primary reasons, and I think I go into this a little bit later into the slide, the people do not adhere to this is the side effects of the medications. So these medications specifically have dry mouth, constipation, blurred vision, so dry vagina, dry eyes. It dries up everything. So it's very difficult to, kind of make the judgment call. Is it worth all of these side effects to actually treat the problem? And the problem that it treats doesn't actually fix it, mainly minimizes the symptoms. It does not fix the problem. And the other scary part is earlier cognitive decline. They've released a black box warning fairly recently that it can lead to earlier cognitive decline. So as we age and we have these problems, the last thing we want is for this to start to go too. Beta-3 agonists, this is mirabegron and vibegron. They relax the detrusor muscles. These are the newest medicines out there. Less side effect profile, but they do have some side effects, mainly elevated blood pressure. So again, lots of people out there do have already some elevated blood pressure. So we don't want to add to that by adding these medications. And honestly, long-term adherence due to the side effects or limit the benefit. So patients don't stay on the meds. It just doesn't work that well for them to actually make the judgment call on staying on these. One thing that we utilize in our practice a lot is pelvic floor physical therapy. So this is evidence-based first-line intervention for urgency, frequency, and stress incontinence and fecal incontinence. Focuses on strengthening and coordination and relaxation of the pelvic floor muscles. No medication side effects, so there's no med, so there's really no problems or no issues with trying this first. And it has durable symptom relief. A great option for women that are postpartum, peri, or postmenopausal and have to avoid any kind of surgeries or any medications. So the first thing that we're going to be talking about is axonic sacral nerve modulation. This is a procedure I do in the clinic. It takes about 15 minutes. And what I'm doing, and I'll go into it later on my other slides, is I'm placing temporary leads so that you can try out the device and see if it helps your symptoms. It's primarily focusing on overactive bladder symptoms, which is frequency and urgency, and then fecal incontinence. You do not have to have fecal incontinence to try this device out. You don't have to have overactive bladder symptoms if you're suffering from fecal incontinence. It just treats all of that. Stress urinary incontinence treated by Bulkamid. We'll talk about that, I think, two subjects after this. So what is sacral nerve modulation? So it's a minimally invasive therapy for overactive bladder, urinary retention, and fecal incontinence. It's FDA approved and safe for long-term uses. Recharges up to 6 to 10 months. It used to be a weekly recharge, which is in fact not the case anymore. So this is an older slide. So you usually charge it about every 6 to 10 months. And there is a non-rechargeable. So you can see over here on my slide deck, there's a smaller device to the left. It's about the size of a stick of gum. That's the one that you do have to charge. So that in about 6 to 9 months, you'll start to have symptoms again. You'll know it's time to charge. You use a little puck. It's about this big. You put it over the device, and it'll give you a beep. Then you charge it for an hour. Then you're good for another 6 to 10 months. That's the remote in the middle. It is very easy to use. They took the patient population that we're going to be treating, if you get what I mean, and thought process of making the device. So it's very easy. It's tactile. You can feel it. And then to the right is the non-rechargeable battery. So this is the one that you basically put in the patient and you forget about it. And then in 15 years, you may have to replace the battery. Biggest alternatives to medications like anticholinergics, like we just spoke about in the last slide, large side effect profile, cognitive decline, not the best medicines out there. So how am I doing? What am I doing during the trial? So the picture on the right is the sacrum, and you can see there's 4 holes on either side of the sacrum. Where I'm trying to aim is that S3 foramen. So I'm trying to stimulate the sacral nerve 3 to normalize communication between the brain and bowel and bladder. So basically think about your brain speaking to your bladder like a highway. And as we get older, or any kind of number of things can happen, that that highway can get broken up. So think of like an earthquake kind of dislodging that highway so that it's not connected anymore. So what the sacral nerve modulation does is reconnect that highway so that the brain and the bladder actually speak again in the bowel. So what I do is I measure up your coccyx. You can see at the bottom of this picture, that's the coccyx. So it's about an area about yay big, about 3 to 4 inches. And then I measure up from it, and then I draw on your back, and then I do the actual P&E trial here in the office. No x-rays. It's called a blind trial. And I will numb up the back, and I place a temporary device in that S3 foramen. So think of it like a pacemaker for the bladder. So for this temporary device, we hook you up, we clean you up, and then we do a 3-day trial. For overactive bladder, it's a 3-day trial. For more urinary retention, which is more complicated to treat, we do a 5-day trial. So we tape you up. You can't shower. You can't garden for anything. And I do these on Tuesdays. And on the Tuesday, we do the trial for 3 days. You're talking to Axonics, which is the company, and they're very, very customer friendly. They're easy to get a hold of. You're talking to them every day about your symptoms. So if, before we do the trial, you have, 10 accidents of urinary incontinence, and you go to the bathroom 10 times in the day, and you only go to the bathroom 3 times in the middle of the night, then on the next day after the trial, we're going to want a decrease in those numbers. So pad usage. So if you leak 4 pads, we'd want you to leak 2. That's a success check mark. If you leak 4 pads and then the next day you're still leaking 4 pads, that's not a good thing. And the next day, if you're leaking 4 pads, still not a good thing. Maybe the sacral nerve modulation is not for you. But if your symptoms decrease to 50%, then we have a conversation and we say, hey, is this worth getting the implant? And about 85% of patients end up going forward with the implant. So implant sends mild electrical pulses, helps restore bladder control, normal emptying, and decreased urgency and frequency. So this is the trial period, or that's the trial device. So this is what you're taped up with your body for the 3 days. External stimulator used for 3 to 7 days. Again, we do 3 days and then 5 days for retention. Helps determine if therapy is going to work. It's the one thing that you get to test drive it. So like if you go test drive a vehicle, you get to test drive the car to see if it, fits your, your body type, your excitement levels, all those kinds of things. You get to test drive it, and you're the one that makes the determination. We'll write down your symptoms and keep a blog of it. I mean, not a blog, but like some documentation of it. But if you don't have a successful trial, you just don't get the actual implant. But again, 85% do move forward with the implant. Step 2, implantation, outpatient surgery, usually 30 to 60 minutes, small device implanted in the upper buttock. So I say it's underneath the bikini line. So you can go out and wear your bikinis, girls. You can wear those and it's below that line. The incision site is usually about the width of a pencil lead, and about maybe an inch long. So you will have a little bit of a scar there. We try to minimize it. And it's rechargeable with a simple remote system. If you get the rechargeable one, if you don't get the rechargeable one, it lasts about 15 years. So why choose Exonics? 85% long-term satisfaction rate, significant reduction in urgency, frequency, and accidents, no daily medications. This is the biggest thing. So you're not putting any medicines through your kidney and your liver, and you don't have to remember to take a pill. You don't have to, oh my gosh, I went on vacation. What did I do with my pills? So that's the biggest reasons people choose it. It's MRI compatible, long battery life with wireless charging, and covered under most insurance plans. So bladder Botox is the competitor to sacral nerve modulation. This is another treatment for overactive bladder. It is FDA approved. It's typically done in the surgical suite. We used to do it in the office, but reimbursements and things have kind of pushed this over into the surgical suite. So you may get some like light sedation, or even something like a Xanax or nitrous in the OR. But it's usually a 15-minute procedure where we actually inject the Botox throughout the bladder. And the whole point of it, the same reason we get Botox up here to prevent these wrinkles, to smooth out that muscle, it's to make the bladder not fire on all cylinders. So this is primarily for urgency and frequency of urination. Involves injecting the Botox into the bladder wall, performed in the office or under light anesthesia. We do have a cash price for this in the office. So if your anesthesia fees are really high, you can do this in the Botox, and it usually is a wash. Indications: urgency, frequency, and failed or intolerant of the oral medications and anticholinergics. So how it works: Botox inhibits the acetylcholine release on the neuromuscular junctions. It reduces involuntary detrusor muscle contractions and increases the bladder capacity. So basically, you're injecting the bladder to where it doesn't squeeze all the time. I talk about AFib a lot. So AFib is the atriums of the heart kind of quivering. So if you can kind of think of the bladder quivering like that, we're injecting the bladder wall so it stops firing on all cylinders. 10 to 20 injections throughout the detrusor muscle. Takes about 10 minutes in the office with lidocaine. Benefits and consideration. Benefits: 67% improvement of OAB symptoms, can reduce or eliminate need for oral medications. Effects last 6 to 9 months on average. Quick recovery and minimal downtime. Considerations: we will do a post-void residual, so we want to make sure that you're emptying well. So the biggest risk of this is if it works too well, then you can't urinate. We may put a catheter inside your bladder for about 24 to 36 hours. But if we scan your bladder about 2 weeks, we just want to make sure you're emptying really well. So Bulkamid. So this is a new treatment for stress urinary incontinence. It's an injectable into the urethra. So Bulkamid is a unique bulking agent. So think about lip injections, right? People get those to get their lips all big. So it's a unique composition, non-particulate, homogeneous gel, mechanism of action that is non-inflammatory. So basically it goes into the tissue and then makes it tighter. It has a precision delivery system. So the whole team has thought about which way about how to deliver this medication. So you can see in the middle here, you have the Bulkamid agent on top. It's attached to a cystoscope that has a camera, and you actually inject it through that little cystoscope. So we go into the urethra, and I think I have a slide later on this, and we inject it into 4 different quadrants to tighten up the urethra. So think about the urethra wide open like this, and if you laugh, you sneeze, you're going to leak through this open because it's wide open. So with Bulkamid, we tighten that up to where it creates a barrier. So 92% of Bulkamid patients identified as cured at 12 months, durability proven out to 7 years. So this lasts for 7 years. Favorable safety profile and long patient preference. So this is what I was talking about. This is how we actually do it. So this is done in the surgical suite. It's a 15-minute procedure. And literally you have your urethra, you're up in stirrups. Dr. Shaw will inject in 4 different quadrants: the 10 o'clock, the 2 o'clock, the 6 o'clock, the 7 o'clock and the 5 o'clock. And you can see on this left picture, it actually tightens that up. So where you can actually have a barrier to urinate. On this right picture, you can kind of see this is the bladder right above. So where we're injecting it is right below the bladder. So what we're doing is creating a barrier. Just think about a dam closing up a river. Now, you should still be able to urinate. Now, I will tell my patients about like 5 to 7 days after, you may have to push to urinate a little more because you are pushing through a barrier. And that's a good thing. That means that we have really tightened up that urethra, and then your stress urinary incontinence symptoms will dissipate even more so. 7-year results demonstrate strong durability. So 2 out of 3 women report being cured or improved at 7 years. So that's 66%. 81% received no further treatment at 7 years. So they were able to, quote, live with it if they were having a minor part of leakage compared to a very high leakage. Bulkamid injections are safe and effective, safe treatment for option for women with stress urinary incontinence or stress predominant multi-use incontinence, providing durable outcomes at about 7 years. So 212 women scheduled to have primary stress urinary incontinence procedure were surveyed about the preference of treatments. So they did a study where they had 212 women that were set up to get a urethral sling. 64% of the women chose treatment with Bulkamid before doing the other treatments. So it's much more less invasive, and it works. We've had a giant success in our practice from it. Especially like even leaking like during sexual intercourse. Some patients will come in here and be like, I'm leaking urine during sexual intercourse. This fixes that. The biggest things are leaking whenever you work out, whenever you cough and sneeze. This is not the best treatment if you're fully incontinent, but if you're leaking during those specific episodes, it's really good. So Bulkamid is a unique bulking agent, unique biocompatible composition. So it's not, your body's not going to reject it. And then we have the precision delivery system, and it's durable and safe. Celesta, so fecal incontinence, the thing that we don't love to talk about. And why is a urologist even talking about it? Primarily, one, because we are able to do it, and patients do have a lot of fecal incontinence, but primarily for chronic urinary tract infections. If you're leaking stool onto a pad that's just a super highway to the vagina, which will grow the E. coli, goes into the urinary tract, causes chronic urinary tract infections. So Celesta is the quick non-surgical treatment for bowel control problems. It's an injectable gel, much like Bulkamid, the only FDA-approved injectable bulking agent for use for patients with bowel incontinence. So estimated 8% of US adults and 58% of women who have stress urinary incontinence also suffer from bowel incontinence. And this gets worse as we get older. So you can see this, the chart at the bottom, the age groups and prevalence of bowel incontinence. It gets all the way up to about 15, almost to 20% above your 70s. So patients have it. We just don't talk about it very much. I will tell you, this is one of my favorite procedures that I do here in the clinic. It's literally 5 to 7 minutes long, and I have, created or I have cured patients that were no longer going out and hanging out with their grandkids, that were no longer going and going on trips because they were so embarrassed about the fecal incontinence. So it's been a very, very interesting thing for me as a practitioner as well. So recognizing the symptoms, like what is bowel incontinence? Bowel incontinence, sometimes referred to as fecal incontinence, is an inability to control the bowel movements. Any of the following may occur: difficulty staying clean, difficulty holding in gas, having an accident before getting to the bathroom, so urge, an overflow, passing stool during normal everyday activities. So if you're, gardening and you leak some stool or in your panties or in your underwear, gentlemen, and passing fecal matter while passing gas. So if you pass gas and some fecal matter actually comes out, Celesta would be a really good option for you. So the benefit of the procedure, it's an outpatient procedure, no anesthesia required, may be repeated in 4 weeks, does not prevent any other therapies. So it's almost one of those things like if you're having any kind of streaks or anything in your underwear, why not do it? There's no really adverse reactions. I have yet to have anyone, knock on wood, have any infections or, constipation. So I've had a lot of success with it. So again, my name is Alex Hughes. I am the lead nurse practitioner for Austin Urology Institute, and I really appreciate you listening to all of the options we have for stress urinary incontinence, overactive bladder, and fecal incontinence. A short recap: Celesta, it's an in-office for fecal incontinence and an in-office injection, fast, low risk, and ideal to mild to moderate cases. Bulkamid, first line, durable solution for stress urinary incontinence, 15-minute injection, minimal side effects, no downtime, lasts about 7 years. Axonics, sacral neuromodulation for overactive bladder and fecal incontinence. Again, you don't have to have fecal incontinence to do it. You don't have to have overactive bladder to do it, but the Axonics device does help both. Rechargeable and non-rechargeable, MRI safe, ideal for lifestyle flexibility. So there's an in-office trial for that one, so you get to try it before you buy it. Bladder Botox, OR procedure, or a cash price office procedure for overactive bladder symptoms, urgency, and frequency. Effective for refractory overactive bladder. Quick OR procedure and an office procedure with high patient satisfaction, but you do have to repeat it. Again, my name is Alex Hughes. I'm the lead nurse practitioner for the Austin Urology Institute. Thank you so much for attending and watching. And if you need any of these things, come and see me. I love doing what I do, and I'd be happy to treat you.